Hey everyone, welcome back to Great Day KC. So happy to have you here. In our Your Health feature, do you suffer from leg pain when doing simple things like walking or going up the stairs? We want to put the focus on what could be the underlying issue, something called PAD. Not something I had ever heard of, but we're going to tell you about it right now. Joining us today to discuss is Dr. Juan Carlos Correa of the Kansas City Vascular Institute. Good morning.
Good morning. Thank you so much for having me.
Thank you for being here. I'm so excited to hear about this because I was unfamiliar. What does PAD stand for and what exactly is it?
Absolutely. It stands for Peripheral Arterial Disease.
Okay.
In layman's terms, the arteries in your body are getting clogged up, and specifically the arteries to your legs.
Okay, so what can happen if this is left untreated?
Sadly, a lot of times it's also related to different arteries in your body that can also get clogged, and if you don't treat it, it affects all the arteries. It affects your ability to walk. You could potentially, heaven forbid, lose a leg because arteries get clogged so bad that it ends up to being an amputation or a heart disease and dying from a heart attack.
Yeah, is there a way that we can have good artery health?
Yes, absolutely. So the number one thing that people can do to prevent or to treat peripheral arterial disease is quitting smoking.
Okay.
That's the number one thing. Second, with the diabetes epidemic that we're in the middle of, taking better control of your diabetes.
Sure.
That'd be the second thing. And then there's obviously genetic risk factors, people who are at family risk or they have high blood pressure. All of these people are at risk. Fortunately, there's lots of medical treatments that can get to the disease early on, and fortunately, there's a lot of ways to figure it out if you have the disease very early and get on top of it.
Yeah. Now you can treat PAD if you have it in your office, correct? Tell us some about that treatment.
Yes, absolutely. We're very, very proud of that. In our office, we offer the whole gamut of treatment. That includes the medical treatment. That involves also walking programs where we'll put you in a treatment and we're going to see if it works or not. And then in our office also, we're able to unclog the arteries in your legs so that you can walk better, or we can get you where you don't end up with an amputation.
How do you do that?
Well, we're very lucky. We have very advanced technology,
Yeah.
and through tiny little wires and catheters, we get into the arteries of the legs and we basically roto-rooter them.
Wow.
To get more blood flow somewhere, yes.
That is crazy. I think of a hose, just going in there and cleaning things out. It's probably more specific than that. But you also have something called below the ankle interventions. What is that and how can it help these patients?
So absolutely. So historically, getting down to the arteries below the ankle and to the foot historically has been incredibly difficult.
Yeah.
It's so far away. The arteries are so small, but fortunately technology has come a long way. And over the past 5 to 10 years, we've been able to prove that if we're able to open up those arteries, we get better outcomes, to the point that currently it's about to be published in the Journals of Vascular Surgery that this is something that we definitely have to be considering when we treat these patients that have complex disease. And we've been doing it in our center for years now.
Absolutely incredible. Where can people go to learn more?
Well, if they go to our website, kcvi.com, there's lots of information. The American Heart Association also has a lot of information about this. Society of Vascular Surgery has a lot of information about this, where we can talk about medical treatments, the walking programs, and if they needed some type of intervention.
Wow, absolutely incredible. Thank you so much for being here, for sharing your knowledge. For more on the Kansas City Vascular Institute, visit their website or call the number listed. They are located in Leawood.